My name is Verity Paz and I've been working in fertility for 15 years. I'm a fertility coach, fertility reflexologist and clinical hypnotherapist. And in that 15-year period, I have helped hundreds of couples to conceive across the UK. So I want to go back a little bit today because I'm seeing more and more people coming into the clinic that have been trying for a baby for a shorter amount of time, so about 12 months, and they're just not getting the help that they need due to a massive funding crisis within the NHS. So I want to talk today about what you can do, what your GP should be doing to help you, but also what you can do to help yourself if you find yourself after 12 months unable to conceive. So firstly, your GP should do some basic blood tests. And let me tell you what those are. More importantly, let me tell you what day that should be done on in your cycle. So the first blood test should be done day 1 to 3 of your cycle to get an accurate result. And I'm seeing now more and more GPs are just doing these blood tests randomly any day in the cycle. And it doesn't actually tell us anything if you do that. So day 1 to 3 is the first set of blood tests. So day 1 of your cycle is the first day of bright red blood. Okay, so it's the first day of you bleed, and that's day 1. So those blood tests, the first blood test is something called FSH. I'm going to tell you about the important ones. The first one is FSH, follicle stimulating hormone. So that is a blood test that measures how much hormone goes to your brain, from your brain to your ovaries. Give me an egg, follicle stimulating hormone, okay? The second blood test is LH, luteinizing hormone. And luteinizing hormone presents itself when you are just about to ovulate. When you pee on a stick and it comes back as positive, then that is luteinizing hormone. That hormone doesn't mean that you've ovulated. It means you are trying to ovulate. So the next blood test should be TSH, thyroid stimulating hormone. And then they should also do estrogen and testosterone as well, and something called prolactin. They're probably the most important blood tests. So I'd want to see those on day 1 to 3 of your cycle. Then I'd want to see another blood test, which is a progesterone blood test. And progesterone is, has this person ovulated? And are her progesterone levels high enough to sustain a pregnancy? So progesterone is the hormone that when we release an egg, that egg's in something called a corpus luteum. And that corpus luteum stays in your ovary and it pumps out progesterone, and it's that hormone that sustains the pregnancy till the placenta takes over. So you kind of want your progesterone ideally to be over 20 as a minimum to show that you've ovulated. And that blood test should be done 7 days past ovulation. So if you have a 28-day cycle, that blood test should be done on day 21 of your cycle. So 7 days past ovulation. If you ovulate on day 14, you'd have a progesterone blood test on day 21. If you're not sure when you ovulate, if you've got a good GP, they will do several progesterone blood tests to try and find out if you are ovulating. They should also do a sperm test. So a sperm test will measure sperm count. It will measure, are the sperm swimming in the right direction? How many of them are there? And what do they look like? And also the pH of the sperm. So if the pH is a little bit high, that can indicate an infection. So that's what they should do as an absolute minimum when you go and see your GP. So what can you do to help yourself? Because I know more than a lot of people how upsetting it can be every single month when you're trying for a baby and you come on your period. Because I've been there and I know what that feels like. And I've worked with so many hundreds of couples around the UK, and I see the devastation for them every month as well. So I want to try and help you as much as I can to prevent you going through that every month. So if you've been trying for a baby for 12 months and you're not quite sure what to do, here are some pointers for you. The first thing that I would do is clean up my diet. That's really key. We're talking about cells. And we're talking about egg cells and sperm cells, and we want them to be really good quality. So cleaning up your diet, making sure you've got lots of antioxidants in your diet, so lots of fruit and vegetables, loads of really healthy fats like avocado, oily fish, and lots of really good quality proteins. That's really important, and you want to minimize ultra processed foods. But also foods with ingredients that you haven't a clue what they are. I mean, if you look at, I don't know, Diet Coke, what's in that? Do you understand any of the ingredients? I know I don't. So cut out foods like that, food and drink like that. Obviously avoiding alcohol is really important, and smoking and vaping, really important as well as cutting out caffeine. So they say that just a couple of cups of coffee or tea a day are fine, but anything more than that can compromise egg and sperm quality. So also it would be a really good idea if you had sex every 2 to 3 days throughout your whole cycle. That's really important as well. One, because you've got oxytocin receptors, ladies, in your uterus. Your uterus is looking for happiness, and gents, the longer sperm stays inside, the mankier it gets, essentially. So you want to be getting rid of it every 3 days. That will increase testosterone levels as well, which means better quality sperm will be coming through. So do those things in the first instance, and then maybe try for another 3 months. I am always available as a fertility coach, even if you've been trying for 4 months. I always say to people, if something's really upsetting you and you've got a hunch that something's wrong, go and seek help. Don't wait. So if you aren't eligible to see your GP, by all means, you can book a fertility coaching session with me, and I will do my best to help you and figure out why you're not conceiving. Also, what I tend to do if somebody's not conceiving is I won't just go with the bog standard test. If I'm suspicious of something, I will test it, and hopefully I'll come up with answers for you. So that's always available. Also, sign up to our newsletter, because you can get loads of stuff on there that's completely free that hopefully is going to help you enormously. So look out for some more videos. I'll be posting some more on this and some more things that can help you. And I hope you get what you're looking for from your GP. And if you don't, get in touch with me.